We have some new information this afternoon on the death of a child with measles. Texas health officials say a school-age child died after being hospitalized with the infection. It is the first reported death since the outbreak began in late January in West Texas. Officials talked about the outbreak at a press conference this afternoon.
Unfortunately, statistically, there's a significant risk of having a death. We're fairly early still in this outbreak. This has been going on about 4 weeks. We see the numbers increasing pretty dramatically with each update. And
so far, dozens have been infected. Many of them are young children. NBC5's Nguyen talked with local doctors about what you need to know about this respiratory illness.
Health officials describe the measles outbreak in West Texas as the largest in nearly 30 years, and this evening, local doctors are worried.
To be honest, I'm just nervous that we're going to see more of this. I'm worried that we're going to see more of this spreading.
Dr. Santina Wheat has been monitoring the situation very closely, given that Chicago had a similar outbreak last year.
We know that measles really spreads quickly amongst people who are unvaccinated. And I think the easiest way to think about this is if you are in a room with 10 people who have not been vaccinated and they're exposed to measles, 9 of the 10 of them will get it.
So far, the Texas Department of Public Health says there have been 124 confirmed cases across 9 counties. More than 100 patients are young children and teens. 18 people have been hospitalized. At least 1 child has died, marking the first death since the outbreak began in late January. Officials say the school-age child was not vaccinated and was being treated in Lubbock last week.
I'm very saddened that there has been a death of a child. I'm not surprised given the extent of the outbreak and the low rates of vaccination, but it breaks my heart as a pediatrician to know that that was a preventable death.
We know measles is a highly contagious respiratory virus that can lead to dangerous complications. Doctors say symptoms include a cough, runny nose, red and watery eyes, white spots inside the mouth, and a red rash.
The most important thing about preventing measles is vaccination. And it takes about 95% of the population being vaccinated to have what we call herd immunity and prevent transmission.
The Centers for Disease Control and Prevention says 2 rounds of the MMR vaccine is 97% effective against the virus. While health officials deal with the crisis in Texas, doctors here urging parents to protect their children. V1 NBC5 News.
Thanks to V.